As high school athletes adapt to a sporadic game schedule during the pandemic, many are facing the challenge of staying in shape and training safely while at home. Let's talk about how they can avoid injury in the process. Joining us live on News Radio 950 is Dr. James Bicos, a sports medicine orthopedic surgeon with Michigan Orthopedic Surgeons, with locations around Metro Detroit, the main office being in Royal Oak. Good morning, doctor.
Good morning, Michael. How you doing?
I'm doing well. I have one of these athletes, high schooler, who's on track and just getting rolling. They're just moving along. Haven't had a meet yet, but he is complaining about feeling some pain from being so sedentary during this pandemic.
Yeah, and it's great to see the kids out there again, and we want to keep them out there too, you know. And it's just, common things that it relates to spring sports, definitely the routine sprains and strains kind of we're looking at, but just like overuse things too. I mean, things like a tendinitis and kind of some of the more serious things with overuse is like a stress fracture that we tend to worry about,
Apparently you're seeing more patients rather than fewer. Have you seen any common injuries that are normal this time of year?
Yeah, I mean, just especially in runners, like an Achilles tendinitis or, you kind of have some, quadricep strains. A lot of the overhead athletes can also get some, kind of shoulder issues, but more of the overuse things just because people are trying to get back very quickly too.
Are you more likely to become injured because you haven't been training or working out or doing anything?
Yeah, no, definitely you can. And that's where the body needs to adapt. But, some of these timelines have kind of been thrust forward a bit. And, all of a sudden the athletes are faced with, tryouts in a week or tryouts in 10 days. And sometimes it's hard for them to get to that same level that they were before the pandemic, too.
What about over those overuse injuries, like, if you've got a shoulder or a rotator cuff or something like that? Do they require surgery?
Not often. A lot of the overuse, unfortunately, it's going to be a little bit of relative rest, as we say it. We don't want to shut the athletes down completely, but, maybe a little cross-training, focusing on other modalities, too. A lot of good things that we tend to avoid, like stretching, it's very good, but, we just don't do enough of it. Also, just a lot of good core strengthening, getting the muscles back in shape. And, instead of doing a lot of heavy lifting, the smaller muscles controlling the joints, those are the ones that really need to get up to speed too.
I would think, when we're talking high school sports or even junior high sports, things like contact sports, football obviously being bad baseball because you can get hit by the ball. But what about things like swimming or diving? I mean, are those injury sports?
Yeah, I mean, those are more the overuse sports, but, a lot of those kids see it when they train a lot, so they're not going to maybe get the contact injury, like, dislocating the kneecap, but, they're going to get more of those overuse injuries, like an Achilles or like a, sore shoulder, rotator cuff issues, just from the repetitive nature of what they're doing.
We're live on WWJ News Radio 950 with Dr. James Bicos, orthopedic surgeon with Michigan Orthopedic Surgeons, main office in Royal Oak. And, Doc, while I have you, I'm going to make double use of this because some of us who are generously referred to as middle-aged at times, are suffering, not just the high schoolers, like a bad knee just from getting out and even walking. I mean, is there things that middle-aged people or adults ought to be doing to stay less injured?
Well, similar things as the athletes actually. I mean, but for us, like I said, lots of good stretching, if something feels, a little achy, taking a little ibuprofen isn't bad either, and also getting into your routine slowly, so I always say for a lot of people, whatever either mileage or weight you're going to think, maybe cut it in half if you haven't been doing something for a while. And that way you set a good goal. And once you hit that goal, then you can start progressing from there. And you just don't want to come out of the gate too quickly, because then that's going to lead to injuries and maybe more frustration, and then you're less likely to get out there and exercise.
Is it knees or elbows or what is it that us older people have trouble with when we get back into this?
Yeah, typically it's going to be knees, a little bit of the hip stuff too. For the overhead stuff, if you're going to be doing any kind of overhead stuff, tennis, even, kind of golf, you're probably looking at more at shoulders and elbows, but if you're going to do more of the, running or biking, it's going to be the knees.
What about those of us that complained when they shut down our gyms and now are having trouble finding time to go back to the gym? Do you recommend the treadmill, or I mean, that seems to be one of the maybe the elliptical would be even a better example, one of the less stressful exercises.
Yeah, sure. I mean, a stationary bike is good. Treadmills are good. Ellipticals are fine. But even just simple exercises you can do at home. I mean, start with some push-ups. You can do some sit-ups. If you do have, a bar that you maybe can do some, easy pull-ups. All that stuff, in terms of just simple core exercises really can bump up your strength, and maybe something that you would have done before because you're going off to the gym, but now at home, you can just do simple sit-ups and push-ups, and that can also get you some strength.
I never thought core would fit into those dirty 4-letter words, but it seems like it's there today. So, lastly, regarding coronavirus, does working out help you avoid? Is there any evidence that that shows that maybe helps you avoid becoming sick?
I wouldn't say avoid, but definitely working out and being healthy. It definitely gives you a better oxygen capacity in your lungs. You tend to feel better. That in addition to, a good healthy diet. I mean, what you want to do is just boost your immune system as much as you can. It won't prevent it, but definitely, it'll make you healthier. I mean, we have seen that in other years in terms of colds and flus, just staying healthy and trying to be healthy, all around, can help.
Dr. Bicos, thanks. Some practical, good advice and insight. Appreciate it.
Thank you very much. Dr.
James Bicos, orthopedic surgeon with Michigan Orthopedic Surgeons, talking about, ways we can injure ourselves and ways we might want to try not to. Here on News.